Welcome back, lovely viewers. Today, we have an exciting topic to discuss that many of you might be curious about. How to know if you're pregnant before missed a period? It's a question that's on the mind of many women, especially those who are eagerly waiting to start or expand their families. So, let's dive right in and explore the fascinating subject together. Signs and symptoms. Before you miss period, your body might be dropping some subtle hints that a baby is on the way. Here are some common signs and symptoms to look out for. Tender breast. If you notice your breast becoming tender or swollen, it could be an early indication of pregnancy. Hormonal changes in your body can cause increased blood flow and sensitivity in your breast. Fatigue and exhaustion. Feeling more tired than usual, even without any significant physical activity, could be a sign that you are pregnant. Hormonal shift and increased progesterone level can leave you feeling exhausted. Nausea and morning sickness. Though commonly associated with the later stages of pregnancy, some women experience mild nausea or morning sickness even before a missed period. If you find yourself feeling queasy or nauseous, it might be worth considering a pregnancy test. Changes in appetite. Have you noticed sudden cravings or aversion to certain food? Increased or decreased appetite can be an early sign of pregnancy. Pay attention to any unusual changes in your food preference. Frequent urination. If you find yourself making more trips to the bathroom than usual, it could be an early indicator of the pregnancy. The hormonal changes in your body can lead to increased blood flow to your kidneys, resulting in more urine production. Mood swings. Have you been experiencing emotional ups and downs lately? Hormonal fluctuations during early pregnancy can cause mood swings, leaving you feeling more irritable or emotional than usual. Spotting or light bleeding. Sometimes you might experience light spotting or bleeding known as an implantation bleeding. It occurs when the fertilized egg implants itself into the uterine lining. If you noticed any unusual bleeding before your expected period, it's worth considering as a potential sign of pregnancy. Heightened sense of smell. Do certain smells suddenly seem stronger or more overwhelming to you? Heightened sense of smell is another early sign of pregnancy. Certain odor can never bothered you before may now make you feel nauseous or uncomfortable. Bloating and abdominal discomfort. Feeling bloated or experiencing mild abdominal discomfort can be early sign of pregnancy. Hormonal changes can affect your digestive system, causing gas and bloating. However, it's important to note that these symptoms can also be attributed to other factors, such as premenstrual syndrome. Increased basal body temperature. Monitoring your basal body temperature can help you identify changes in your menstrual cycle and potential pregnancy. If you notice a sustained increase in your BBT for more than 2 weeks, it might indicate that you're pregnant. Hormonal changes. So, you are experiencing some of these early signs. What's actually happening inside your body? Let's take a closer look at the hormonal changes that occur during early pregnancy. Human chronic gonadotropin, HCG. Once the fertilized egg implants itself into the uterus, your body starts producing HCG, a hormone that helps maintain pregnancy. Detecting HCG through a sensitive pregnancy test can give you an early indication of pregnancy. Progesterone. Another hormone that increases during early pregnancy is progesterone. It helps prepare the uterus for implantation and supports the development of the placenta. Early detection method. While missed periods are a reliable sign of pregnancy, some early detection method can provide insights even before that. Here are a few methods you can try. Home pregnancy test. These tests detect the presence of HCG in your urine. Some tests claim to provide accurate results as early as few days before your expected period. Blood test. A blood test at your doctor's office can detect HCG level even earlier than a home pregnancy test. This method can give you more precise results, especially if you are eager to know as soon as possible. Tracking basal body temperature. Charting your basal body temperature can help identify a subtle rise that occurs after ovulation, indicating possible pregnancy. False negative and false positive. While early detection methods are generally accurate, it's important to be aware of the possibility of false negative or false positive. Factors like testing too early, using expired tests, or certain medication can affect the result. Always consult with your healthcare provider for confirmation if you have doubts. And there you have it. Our dear viewers, some valuable insight into how to know if you're pregnant before missed period. Remember, everybody's body is different, and these early signs can vary from person to person. If you suspect you might be pregnant, consult with your healthcare provider for proper guidance and support. If you found this video helpful, give it a thumbs up and share it with your friends who might find it useful too. And don't forget to subscribe our